everyone, this is ritagangwani once again with another very important topic. And the topic is stay safe and behave like responsible citizens of India. It's time we, the citizens of India, understand our own role and responsibility in limiting the spread and transmission of COVID-19. This brings us to a pertinent question. How are people expected to conduct themselves in critical times? Are we, as a society, as citizens of India, expected to behave responsibly or irresponsibly? We took it very easy after the first wave. Almost everyone stopped following any precautions. People were gathering in large crowds, traveling, partying, doing all kinds of events without taking any precautions. So many of us are guilty of this crime. In these crucial times, we need to understand that our actions have consequences, not only for us, but also for others. A single mistake in terms of socially irresponsible behavior won't only cost us dear, but also take a heavy toll on our fellow citizens, family, neighbors, and our community. This is a moment of reckoning for all of us, and we must think of how we cannot only help ourselves, but also those around us. It is time we, the citizens, understand our role, responsibility in limiting the spread of transmission. The government is doing what it can, and in turn, let's do what we can and realize our social responsibility. You will say, we already know what to do, but in spite of knowing, we don't behave responsibly. It's now or never. Let's not forget our social responsibility. Make wearing a mask a normal part of being around other people. The appropriate use, storage, and cleaning are essential to make masks as effective as possible. Clean your hands before you put on your mask, as well as before and after you take it off, and after you touch it at any time. Make sure it covers both your nose, mouth, and chin. When you take off a mask, store it in a clean plastic bag, and every day either wash it if it's a fabric mask or dispose of a medical mask in the trash bin. Don't use masks with valves. Wash all fruits, vegetables, and don't forget to sanitize any packets which you receive from outside. Maintain at least a 1 meter distance between yourself and others to reduce your risk of infection when you cough, sneeze, or speak. The further away, the better. Avoid the 3 C's, spaces that are closed, crowded, or involve close contact. The risk of getting COVID-19 are higher in crowded and inadequately ventilated spaces where infected people spend long periods together. Those environments are where the virus appears to spread by respiratory droplets or aerosols more efficiently. So taking precautions is even more important. Meet people outside. Outdoor gatherings are safer than indoor ones, particularly if indoor spaces are small and without outdoor air coming in. Avoid crowded or indoor settings, but if you can't, then take precautions. Keep your windows open, have cross ventilation and let the fresh air circulate. Regularly and thoroughly clean your hands with an alcohol-based hand rub or wash them with soap and water. This eliminates germs including viruses that may be on your hands. Cover your mouth and nose with your bent elbow or tissue when you cough or sneeze. Then dispose the used tissue immediately into a closed bin and wash your hands. By following good respiratory hygiene, you protect the people around you from virus which causes colds, flu, and especially COVID-19. Avoid stepping out of your house unless it's a do or die situation and you just can't help it. Take a thorough bath on return. Put your clothes away, disinfect them, press them well before you wear them again, and keep yourself safe. Know the full range of symptoms of COVID-19. The most common are fever, dry cough, tiredness. Other symptoms that are less common may affect some patients, including loss of taste and smell, aches and pains, headache, sore throat, nasal congestion, red eyes, diarrhea, or a skin rash. Stay home and isolate even if you have minor symptoms such as cough, headache, mild fever unless you recover. Call your healthcare provider or hotline for advice. Have someone bring you supplies. If you need to leave your house or have someone near you, wear a medical mask to avoid infecting others. If you have fever, cough and difficulty breathing, seek medical attention immediately and isolate yourself, quarantine yourself. Get a vaccination as soon as you can. This will protect you from very hard effects of this virus. So you all know that there are 2 doses you have to take and there is a gap between the 2 doses. So try and get your vaccination as soon as possible. Keep up to date on the latest information from trusted sources such as WHO or your local and national health authorities. Local and national authorities and public health units are best placed to advise on what people in your area should be doing to protect themselves. Protect yourself from fake news. Think positive. This is just a phase. I'm sure this too will pass. But yes, this is going to pass only if we cooperate and if we take responsibility of ourselves, families, and each and every person around us, and specifically of our country. So go ahead, take that first step of taking the responsibility and be a very wonderful, responsible citizen of India. Till we meet again, this is bye from Ritagangwani. Stay safe and stay positive.